Shalom. I'd like to thank you for tuning in to another broadcast of Black and Healthy, Restoring Black America here on YouTube and also broadcasting live on Facebook on in the Country Living in the City page. I am your host, Jawanda Smith, RN Case Manager and Community Advocate. Today, I have a exciting show for you. Me and my colleague and friend, Kitty Boyd from Las Vegas, we actually had a little watch party together and we watched the movie Aftershock. And this is the reaction, and we're going to discuss some of the things that you may be able to do in your community, and we're going to talk about the differences and in having home births versus birthing centers versus the hospitals, which one is the best for our communities. So, how are you doing today, Miss Cheryl? How you
Oh,
doing? Get it?
I am great. How are you doing?
Doing well, doing well. I'm just actually playing in the gardens today, as usual. but I just wanted you to watch that movie with me. And so, what was your first reaction when you first started watching it?
Well, I wasn't surprised, first of all, because I've heard so much about, you know, how differently they treat our people from other people. And
Mhm.
also with me working in the hospital, not in labor and delivery, but in other parts of the hospital, I see how they make sure that they manage pain of other races and then they forget about ours. You know, we'll come from surgery and they'll say, well, Tylenol, 500 milligrams, Q 6 hours. You're just coming from surgery. But you'll have someone that's coming in that may have a fracture or something like that. And they'll give them something more stronger, like morphine IV or Dilaudid IV. So
Mhm.
I don't think that the medical community feels as if we're able to feel pain. They think that let's just say that they think that our pain threshold is a little bit higher than everyone else's. And that's not the case. We're all human and we should be treated, as such. But I've seen it too many times in the hospital.
Yes, I actually have family members that have passed away in childbirth for one reason or another. Um, and neglect was probably part of it. Um, um, but I can't say for certain because I was not present. I wasn't in that state at the time, and I wasn't a nurse then. But unfortunately, the we have a four-time at higher rate than white women dying in childbirth.
Mhm.
And also, you know, the movie brought out so many statistics and how we're fighting for legislature for this, that, and the other. But ultimately, I ask you this because you work in the field. Even if there's legislature and they're trying to do the birthing centers versus the hospitals now as a happy medium between home birth and actually hospital care. Do you think that's going to change much? Or, I mean, we did see a great example of that, but when you're on camera, everything is hunky dory. So, what do you think is the ultimate solution if you want to, speak of it frankly or candidly?
Well, first of all, why do we need legislature to treat us like humans? That's number one. That makes no sense to me. So we need rules to go by in order to treat us the same as everybody else.
Mhm.
The birthing centers, that's a good idea, I think. But if I recall, the insurance does not cover that, right?
Right. So that limits,
So who has that type of money?
no, right, exactly. So what I would say legislature that needs to be put in place is that they, if even if they are getting public assistance, they should be allowed to use the birthing centers.
Mm-hmm.
And but that's up to Medicaid to pay for that. You know, we're already paying taxes, and and we don't know where our taxes is going. I don't, you know, we just don't, you know. But
Well, that's just like the banks. You put your money in, you save, save, save. You go in for a loan. They don't approve you for the loan, but then they approve other races for the loan, but they're using your money to approve them for the loan. So, I mean, it's the same. The tax dollars, it's not, we have to learn to take care of ourselves. And that's just the short and long of it.
so would you think the model of us doing it, and you know, not to negate, not to negate that there are people of other races that don't have anything against us, okay? And
Mhm.
they work, I've worked side by side with doctors and nurses that I know are not biased toward anyone. They believe in taking care of people, and it doesn't matter what race they are. But then, unless you can control racism in all the areas you live in, which is virtually impossible, I think until people start getting in trouble for being a racist, that's what I mean by legislature. If you have intentionally withheld care from someone just because of their race or their ethnicity or their beliefs or what you don't attend, you know, you don't agree with the same things, unless, you know, other than you may sue, you may get some compensation for it, but that person, that racist is still allowed to practice, that racist is still allowed to care for people. If I knew someone as a patient myself, I would not want a racist taking care of me. I mean, someone I blatantly know is a racist is not going to touch me. Why? Because I'm in fear of my life at that point.
Exactly. Exactly.
So, and it's crazy how these women in the movie kept saying, "I felt unsafe." Why would you feel unsafe in a hospital that's supposed to be caring for you and you're pregnant? At the most vulnerable a woman can be is pregnant. And yeah, the movie put me in tears. Every time I will go over the clips to look at the information that was in there, it was heartbreaking because these young men who were in there with their partners, loving every moment of the birth and everything, and then it was being ignored. She said she was short of breath, she's having chest pain. Nobody looked at anything. And that platelet count, that floored me.
Girl,
Did you see that platelet count?
I saw those numbers and I'm like,
Okay.
WEF.
Well, for those that haven't seen the movie, any nurse knows that the platelet count is not supposed to go below uh, 140, 150 at the most.
I think the lowest was 39.
Right. And that's when she first started going. That's when she first started going. That was months in the beginning. So they didn't even see it from the beginning that she had this low platelet count. She had HELP syndrome. And for someone who lived through HELP syndrome, hello, I lived. I lived. Whew, yeah. Mm. But I lived because my daddy was there. I can
Yeah,
tell
and
you
you
that
know
because
what? And you made a good point because your father was there.
my
I
father was
think
there.
that you should go with someone that knows what's going on, that has
Mhm.
an idea, someone that's going to advocate for you,
Yes,
to
and
go with you. Yes.
right, because right now I do believe the birthing centers are a great idea. I think we have doctors, we need to collab to get more birthing centers in our black and brown neighborhoods,
Right, right.
because it's not just us. I mean, the black and brown women are the ones that are getting neglected, because you seen there was a couple of Hispanic ladies there,
Hmm.
and everything, and Native ladies, because on the reservations, you know what reservation care look like.
It's horrible.
You're out there in Las Vegas,
It's absolutely horrible.
right?
I
Can you
can't.
share an experience? Because I know you've been out that way.
Well, the clinics that they have, what you're not going to have a doctor there every day. That's number one.
Hmm.
For a couple of the reservations, there's not a doctor. The doctor comes like maybe twice a week. So with these people being on the reservation, there's long lines waiting to see the doctor. By the time the doctor get to patient number 32, they're exhausted. So then we just then we're like, then they're not actively listening to what's going on with the patient. And honestly, they really don't care. Now, I've seen where on the reservation it was a doctor that was the same ethnicity as the people on the reservation. So there was a different type of communication. You know, he would sit down, he would talk to them, he would really try to, relate to them and see what's going on, and, order tests that someone else probably wouldn't order. And they would walk out feeling good, feeling safe, feel like, I'm going to be okay. We're going to take these
Hmm.
tests and I'm going to be okay. But for the most part, a lot of them don't really care. It's just a job. It's just something to do. And they
Hmm.
don't, they really don't care. So we have to learn how to do us and to care about ourselves. We can't continue to depend on other people to care about us. We have to do it. And
Right.
that's not being racist. That's just being factual.
Yeah, because we can't, there's many people I know that are indifferent to things, and they'll say, well, I'm not like that because they're like that. I understand that. It's a
Mhm.
systemic thing. But I said, but in punishment is never behind it. When things happen to us, there's never any repercussions for anything that happens to us. so,
No, there's
so
not.
the thing, so knowing that,
Uh-huh.
like I said, we need, like what the midwife was saying. She said there's not, most of the midwives in the country are Caucasian.
I
So,
found that so interesting, the
mhm,
history to where the midwife derived from. I found that so very, very interesting.
yeah, this movie showed so much
Mhm.
historical information regarding nursing, and how they used us as experiments. And
Mhm.
today, I do believe there's many doctors. I did a previous video when I was doing the one on implicit bias, how in as late as I had statistics up to 2019. In 2019, they went to John Hopkins and interviewed the white male students there and asked them issues of pain and things about what they thought about black people. And to this day, I mean, they still believe we have less nerve endings. They still believe we have thicker skin, and we're tolerant to pain.
Mhm.
And that was the excuse Willie Lynch gave them to beat us. You see, he said we don't feel pain, so you can just beat us as much as you can. So, but when a woman is at the most vulnerable and having a baby,
Mm-hmm.
I've always seen that, my grandmother had her children at home. Most of the people in the country had
Mm-hmm.
their children at home. And there was a midwife around, in the country setting, like they showed you post slavery from the movie.
Right.
Um, but I think that's what our communities. I remember when I was just a little kid and growing up in the 70s, and there was always someone in the neighborhood that would, uh, when the kids would get the scrapes and stuff, they'd have made up the salve on the stove and to
What
put
they
it
call
on
it?
everybody.
They call it
Made
the concoctions. Let me get
the
this.
concoction or whatever, you see all these medicinal plants and those were the things, but those were the people that delivered babies in your neighborhood. Oh, your camera went out. Kitty done left the show. But what I was talking about is the things, the old home remedies that many things our grandmothers did, and I used to hear stories about somebody delivered a baby on the kitchen floor.
Mm-hmm.
Um, there you go. So, um, right, delivered a baby on the kitchen floor. So it angers the movie angered me. It made me sad. It also brought up the history of how they experimented on us. And this is not the only video I'm going to do because not only are we the highest, like I said, she even showed you the other country, and I wanted to share with the audience. Um, the point in the movie that they were making was I couldn't find the graph, and I didn't want to go through scrolling through the whole movie, but where we're the highest in mortality birth rates in the world,
Mm-hmm. Mm-hmm.
and they have universal health care. We don't.
Mm-hmm.
But everybody yelling and screaming about this abortion things, but these are women that want to have babies and they die.
Mm-hmm.
And then and the fathers are left to, or the family is left to care for the child. And it happens too often through neglect because of the statistics, they said 60% of
Was
them of those of yeah, it was 60% could have been prevented. Now every birth doesn't end in a happy ending all the time. Some
no.
complications does happen and you can't avoid it.
Right.
But if 60% of the percentage of black women dying in childbirth was preventable, that means that's telling me somebody made a choice not to look at that or not to take care of that. Like that young man said at the end, he said, "No, that's not just neglect. That was a choice somebody made."
Mm-hmm. Mm-hmm.
You if you seen that woman's platelet count at 39, really,
I was dying.
you you
Like,
the nurse, and you seen those labs and said,
and
"Oh
Jawan,
yeah,
the labs are in red. And not only that,
yeah, the high
when you
levels
have
are always in your face."
and no,
We
and
know
not only
that as
that,
nurses.
it's like when you have a lab that's like that, the lab
Yeah,
calls the nurse and verify
that is
if
a
they
critical
know
high.
that the
She had a critical high going in.
exactly they do contact the nurse. So I don't know if they was in between reports or whatever, but they screwed up royally.
Right. And then, like I said, she was low the whole time.
Mm-hmm.
And literally, it just angered me being a nurse and being someone that had to read labs and had to call in many critical labs and yell at doctors, saying, "Get your butt up here," because this person gonna bleed to death.
Mhm.
There's so much that goes on in the health system that is against us.
Mhm.
And I created this channel to make people aware.
Mhm.
uh, it's not that I can change anything in the system. What I'm saying is we have to advocate, just like that young lady, that midwife, that black midwife.
Mhm.
She goes to the schools to encourage more of us to go into midwife training.
Mhm.
My massage therapist that's still helping me with my neck, um, she's a doula, so she's went for that training. So there's so many things that we can do. Like I said, even the nurses, our younger black nurses, we can encourage them to go get into a specialty, that
Mhm.
specialty to become a midwife.
Yeah.
If you're going to become a nurse, if you're going to practice, try to practice in our neighborhoods. Try to establish something like that young man is trying to do, where he's trying to get a birthing center in that borough, you
Right.
know. And he was collaborating with, many Latin Americans and everything, because they need it too, also
Right.
because they get discriminated against too.
Mhm.
It's so blatant that America doesn't see.
No,
Well, yes they do. Yes they
don't
do.
say they don't see.
They see it. But when the other countries, yeah, and there was a comment in the section on YouTube saying that, yeah, that movie Aftershock brought that up, that we are actually, they do more C sections on us than anybody. 80, how many? Well, I forgot what the percentage was, but it was up there. It was past 50 now. And I had three children. Two of them was vaginal. The last one was a C-section. And I think all of them would have been C-section if it was up to them.
Mhm.
But
Because I know
you
years
I
ago,
had.
the C-section was like $1,000 more
Hmm.
than the natural birth. Because I ended up getting a C-section, and he hadn't even examined me. It was my first visit, and he hadn't even examined me. And he came in, and he said that you're gonna have to have a C-section.
How
And
did
I
he
didn't know.
determine
I
that?
was, what, 22 years old. I was totally clueless as to what.
Right.
And it was horrible. And then later, when I had my youngest child, I had a vaginal birth. Really?
Yeah, over the I encourage everyone to buy or support Dr. Joy DeGruy, because she's trying to help us understand that a lot of our behaviors come from trauma. You see what I'm saying?
Yes.
We're scared to fight things, but
Hmm.
we have to fight when we're in the hospitals, or when you're getting when you feel like you're not being treated. That's why I always promote advocacy. Or like you said, make sure you got somebody with you that
Hmm.
knows. I mean, everybody in my family calls me when they going into the hospital about something, you
And
know.
sad to say, but it's true. Sometimes you have to act a fool.
I hear you, Cheryl. I hear you. Oh my goodness. But what would you suggest that can help, you know, increase the awareness in our, because I know when we talk about it, a lot of people say, "Oh yeah, I know," but there's many things that's going on trying to help the situation. So, what would you suggest? about how to make their awareness in our community and try to get more people in our community involved in trying to get birthing centers into our neighborhood.
Well, I think that is something. Well, first of all, we have to get out into the communities and educate our people, because the birthing centers, that's going to be a long time to come. And
Mm-hmm.
our people need to understand signs and symptoms and know what questions to ask and
Mm-hmm.
ask what are my labs, what's our plate. They have to be like a non-degree nurse, honestly,
Mm-hmm.
because they need to do a lot of reading and
Right.
with their pregnancy. And if they have some comorbidities or whatever the case, they need to read about those also.
Right.
So I think education, educating themselves and us helping educate them, I think that's a good place to start. Now with these birthing centers, you're gonna have to go to Washington for that, because you just can't have one birthing center here and one birthing center there. You're gonna have to go to Washington for that, and handle that.
Right.
Uh-huh.
I'm posting the link in case anyone wants to come on and share a story or opinion or and if they know about something that's going on in the community. I
Mm-hmm.
have posted it, and we the audio, I would love you guys to join in and give me some input, because this channel is for you guys.
Mm-hmm.
It I'm trying as a nurse of how long we've been nursing. Oh my God, it's been too far
Yeah.
enough. Yeah, I've been a nurse since I was 22.
Mm-hmm.
So yeah, it's been a long time. And
So you've been a
I
nurse. So you've been a nurse for 60 years.
no, since
I'm just kidding.
no, no, I ain't 60. No. Girl, you making me older than what
That was just a joke. I'm like, oh.
Oh my goodness, girl, thank you. Thank you very much. I know the gray hair there. There you go.
Girl, I
But I've
appreciate you,
been in
Greg.
the field over 30 years,
Mm-hmm.
because I started in it in my late teens, because
Mm-hmm.
I was a single mom, and that like I said, I shared that before I was a STNA. Um, so I was a STNA and LPN, RN, now I'm RN case manager and community advocate. So that's what I'm trying. I'm trying to advocate for our people, trying to let people know that there's disparities all around us.
Mm-hmm.
Being descendants of slaves, I'm not ashamed to say that. Just to say, just because I know where I came from. The
Mm-hmm.
thing is, I know why my treatment is there, because I'm not afraid to understand what happened in the past.
Right.
I understand what happened in the past. I don't live in the past. See, that's the misconception. Because, see, I learned from what happened, even the mistakes our own people made. I
Mm-hmm.
had to learn from that. So, but I seen that we were more productive then than we are now. So, why? What's the difference? The difference is we're so separated that we don't understand that it takes us as a community to take care of us. Because how many times we're going to get spit on before you say, I'm not going to get spit on anymore?
Right. Right.
It's too many of us educated, and that we have these things available and the resources, but we tend to put our money in the other nations, and we don't put them into ourselves.
Mm-hmm. Mm-hmm.
So I do want a birthing center. I like the birthing center idea because it has the medical technology there available if needed, but you have the choice to make it look more like a home environment.
Mhm.
And it was so relaxing. She went through that whole labor, and it was just a beautiful experience.
Mhm.
And she felt safe. You could tell she felt safe.
Mhm.
But those other two ladies went through so much trauma. I can just imagine her not being able to breathe and nobody saying anything.
Right.
You know. So I'm going to try to post this link one more time. Um, and if anyone would like that's viewing or would like to join, I'm gonna post the link again,
Okay.
um, just to because I would like to hear from the community. It's so many things that's missing in our communities. We don't have grocery stores. We have to go to, a lot of our women are, we have to go to the hospitals or the county hospitals. Oh my God.
Yeah.
County hospitals are just the worst, and I've worked in county hospitals. We both worked at that one mental place.
Oh my
I won't name
goodness.
the name.
Oh.
Oh, and, and so, it's so much that's needed in our communities. And it's like, I just want us to know that it's needed and there are things that's out there
Mhm.
uh, that people, our people, are coming together to do things.
Mhm.
And we need to make more of our people aware so we can be in a safe place. I know everyone, there's a good thing for the internet and a bad thing for the internet. I like to use the internet as for something good. So I try to share these things with the community, and I will post all the links in the description of all the resources we have. But I did want to share with the audience this it's a research article that I found. Let me take that down and let me get to that screen. But it's actually a research study that they've been doing on the mortality birth rates all over the world. And just to let you see that a lot of those statistics in the movie came from this research. And just wanted to show you. Let's see. Uh-oh. I will learn how to move this thing eventually. Well, it's basically maternal mortality and maternity care in the United States compared to 10 other developed countries. And, it was saying in the abstract, it says most maternal deaths are preventable, but they have been increasing in the United States. Other high income countries with success in preventing maternal deaths offer potential lessons for the US. To compare maternal mortality rates in the US with 10 other high income countries and identify the differences in maternal care workforces, postpartum care, access, and paid maternity leave policies that may help account for observed differences. And they go through the key findings, but basically, in the statistics, of course, we're at the highest percentage in all the the things in all the statistics. We're the highest in death rates when it comes to maternity. Uh, just a moment. So, Cheryl, what did you think about what these other articles are saying about us? So, what these articles and research said, because literally it's it's apparent that even in research studies that's done overseas, they say the same thing. Oh, you can't hear me? Oh, Well, I'm having technical difficulties with my guest, but well, that's pretty much all my show for today. If you have any comments or any stories to share, please leave them in the comment section below the video. Um, Please check out the movie Aftershock. There's many resources in that movie, and I'll be putting those below the description after the video once I edit and post. But this is a very alarming thing in our community right now, and it's gaining attention, but we need to help push the information along because it's so many of our families that are experiencing this where they're going in the hospital and they're never coming out. Why is that happening so much? And especially when you don't have anyone to advocate for you or talk on your behalf. As I said before, and as Cheryl said, always try to have someone there that do know the medical system, know a little bit. You just have to be aware. If you don't know, educate yourself. You can always ask questions because the more questions you ask, you can tell whether or not a healthcare professional is going to be take the time and be courteous and give you the bedside manner that you deserve. My patients, I spend hours on the phones with them and all the time. It doesn't matter who calls me. If they're on my list, I have to take care of them. And sometimes they call me just to tell me, because I'm a case manager. So I don't I don't do patient care, but I help a lot out in the home. And they could just be calling me just to tell me that their toilet's not working. But I listen to those things. So always try to support each other, always try to, and, ask the questions that's needed to get the information that you need. And always have people treat you the way that you expect to be treated. And if you have any questions, like I said, post it in the comment section. So that's all I have for you guys today. Take care of yourself and take care of each other. Until next time, Shalom.
One week ago, 3 Black women were killed, 2 others injured in that horrific domestic violence incident. The alleged gunman, a 19-year-old man who was the boyfriend of one of the women shot. It's an epidemic that the local and domestic violence agency here in Virginia Beach says is only getting worse. After the mass shooting in Norfolk, one that killed 3 women and injured 2 more, the hotline at the Samaritan House Domestic Violence Center surged in calls. Women so concerned looking at their own situation that they needed help.
Women in color are killed at a disproportionate rate than any other race.
The statistics are hard to swallow. Listen to this. According to the CDC, African American women are 3 times more likely than white women to experience death as a result of domestic violence. 22% of domestic violence events ending in homicide are of African American women. The CDC also says domestic violence is one of the leading causes of death for Black women ages 15 to 35.